Hello and welcome to another episode of Her Helping Habit on Air. We are a Canadian fertility agency specializing in known egg donation, embryo donation, and surrogacy, helping intended parents, surrogates, and donors navigate their journeys through education, support, and advocacy. Through open conversations and shared experiences, we aim to empower everyone involved in the family building process. Her Helping Habit on Air does not provide medical advice. These are simply lived experiences shared to help make the often uncharted world of infertility feel a little less scary.
I'm joined here today by Katie, the founder and creator of Her Helping Habit, and by Sarah, our donor coordinator. So without further ado, I think we should just dive straight in. So here we go.
Yeah, that's like the biggest question to ask is like, what is your estrogen and how many follicles did you have? I always ask them after the appointment, like, oh, how many follicles did the nurse say? And they're usually like, what is that? And then I'm like, oh, okay, well, at your next appointment, you're going to want to ask how many follicles are on each side. And those are potential eggs, essentially. So if you're growing 5 follicles on your left, well, there's 5 potential eggs on your left. And then 5 on your right, well, now you've got a total of 10 potential eggs. Because if we're seeing 20 on each side, well, like that's a huge alarming factor. Like whatever, we're seeing maybe 48. So if the donor's not comfortable, well, then that's when we need to contact the nurse and advocate for either lower doses, depending on how far she's in her cycle, or a non-HCG trigger, because anything over 25, 30 eggs, they're at risk for being overstimulated.
Yeah, and I think that it's the trigger is where it's really important. So we are like up to date, because negotiating those triggers and arguing when it's not appropriate for a donor to have HCG, like it's really important for us to be up to date with that, so we can jump in there and just be like, look, she's got 50 follicles, like not appropriate for you to be giving her 1,000 milligrams of HCG. Yeah, I don't know if lowering the medication, like sometimes they'll let them coast. It's more about controlling the estrogen at that point. But once you've started it, like once you've recruited those follicles.
I mean, I guess it's going to be probably like that's maybe more early. Like if she has like 30 follicles to start, and then we go in at first appointment and she's jumped up to 40 or 45, like that's probably not very common. But if she isn't, and that's something they should be thinking of to start. If she's starting with a baseline of a lot of follicles, they should be starting her on lower doses anyways. But if for some reason all those follicles are really developing right off, like it's not happening as often where there's lowering, because you need to lower the doses early on to really make a difference. Coasting is another thing. There's a couple things we can do, but like Sarah said, the main thing is that trigger. And that's where we were getting into an issue, and we were talking about needing that med release, because this is where we wanted to advocate for her and talk to the nurse. And they had talked to us the entire cycle, no problem, without this consent. But when it came to crunch time, they're like, oh, now we can't talk to you. You can't advocate for her because this isn't on file. So like, it's one of those things that a lot of doctors are black and white. A lot of stuff in this world is gray. Donors are not like IVF patients who are infertile that need higher doses than maybe HCG. Like these are young, healthy women, and we should be looking at them differently. So that is something we need to sometimes remind a lot of the doctors. But just, I think that's the biggest thing that we're really looking out for with these check-ins. So what's your estrogen number? Because if that's super high, and your follicle counts, those are 2 indicators.
And do you guys know why they want to give donors HCG with the trigger, like what the draw is for the clinic in that? So it does 2 things. Well, 3 really. So it does improve embryo quality. Like there is a good argument and good studies to support that a little bit of HCG will improve embryo quality and development. But that can be a really low amount. Like I've argued down with Dr. to give like 250 instead of, 1,000 or 1,500 or 5,000. If you were doing a pure HCG trigger, you would be using 10,000. When I had my horrible OHSS, I used 1,000. So that was clearly still too much. So dropping it down to like 250 even 500 will reduce your risk significantly, not to 0. The other reasons they want to use it is that agonist only, like Lupron or the other brands, has about a 1% failure rate. So sometimes in about 1% of cycles, it doesn't have your pituitary gland doesn't elicit an LH surge. So that would mean that the eggs aren't maturing or cleaving away from the wall, so they're not able to be collected, or you get what's like empty follicle syndrome or whatever. And then the other one is it gives you a wider window. So if your doctor is late for retrieval, it is not a big deal. If he is late and you've taken a Lupron only trigger and you're running like an hour or two behind, that's a really big deal. You have a much smaller window to get those eggs in, like it's much more precise. So those are kind of the draws, the pros and cons of HCG. So that's why doctors will want it. But this whole thing's about a balance between recipient outcome and donor health, right? It's not just recipient outcome. So just so everyone is like knows why a clinic would, because you're probably wondering, why would you even give donors this HCG if it puts them at risk? So there are reasons, and if someone's looking like they're having 10 or 15 eggs, I would 100% agree that some HCG is appropriate, like no problem. Even up to 20, even up to 25, anything 30 plus, I would say that it's not appropriate, or you need a very, very reduced amount.
Yeah,
So,
no, that was great. I guess there's something just really briefly to touch on with the meds is, or not just the meds, the conflict of interest. Like the parents are paying, so I find, a lot of doctors, their best interest lies with the parent, and they want to try to get the parent pregnant. And they're like, oh, this donor's young and healthy, she's got all these eggs, it's no problem, whatever. And we're kind of forgotten about in this process, which isn't really fair. The donor's putting a lot on the line, her body. She's risking a lot really for nothing in Canada, where you're not compensated. And even if you are compensated, I don't think that's, it's the only tissue donation where you could potentially be paid. So, if you're donating any other part of your body, your heart, your liver, whatever, or kidney, let's say, because you're alive, you have a doctor for you donating your kidney, and the recipient has a doctor receiving the kidney. So there's no conflict of interest. They're both advocating for their patient. And egg donation is strange in that sense, because we have two patients and we have one doctor advocating, and that's where I feel they want to get their person pregnant, and the donors are forgotten about, and it creates a gray area where they're trying to, like Sarah said, we need to balance those. But at the end of the day, I feel we're the advocate for the donor, because there isn't that independent advocate like you would have donating a kidney and having your own doctor. So just kind of keep that in mind, because it's a really big role I think you're playing in the coordinator.
For sure. It's a fine line between giving medical advice and advocacy for the right decision, because, like Katie said, it's just easy to get wrapped up in padding your clinic stats. You really want your success rates to be up there, because that's good for your clinic. And just they're the ones who are paying for it, so they want to get pregnant. You want a happy outcome. And as a donor, like, you're really emotionally involved in the process at that point. Like when I was taking that HCG, I knew it was a risk. I didn't know quite how many follicles I had, but I knew that there was some risk, but I wanted it to go well so badly that I was willing to just be like, well, maybe my health, doesn't matter. So when the donor's in that, like, really emotional, full of hormones, like, and they're not going to have a medical background necessarily about it, like, they need someone else to step in and just be a stern voice to the clinic sometimes.
And same for the parents. The parents have like this doctor telling them like, oh, you're going to get 30 eggs or however many eggs, or maybe you're not going to get enough eggs. We really need to, give her this HCG. And they're just like, okay, I don't know anything about, you're a doctor. Let's just trust the doctor. And then they think, oh, like my donor is pushing back. Like, what's wrong with her? And she's not a doctor. But, then we're kind of the middleman, and it's, explaining this is for the best interest of your donor and her health. And, she's giving up a lot up for you. So, and having that balance, because I don't think that's properly explained to the parents from a doctor's perspective. And then sometimes they're just hearing from the doctor, oh, your donor, she's giving us trouble, like she doesn't want to take this HCG, that does happen.
Yeah, a lot of times if people have done their own cycles, then they'll have used HCG because they're poor responders. right? So if they've had previous IVF cycles that have failed, then chances are they've used the HCG, because when you only have 5 eggs, that definitely is your best bet and is the appropriate course of medication. So that may be all they're familiar with.
Yeah.
So
Yes, it's
that's
a lot of education intertwined with that advocacy.
If you'd like to connect with us or have questions about known egg donation, embryo donation, surrogacy, becoming a parent, or exploring whether becoming a surrogate or donor is right for you, you can find us online at Her Helping Habit or email us at info@herhelpinghabit.com. We're passionate about educating and supporting all parties throughout the journey, and you can also book a free consultation with one of our coordinators directly through our website. Thanks for listening, and we'll talk to you again soon on the next episode of Her Helping Habit on Air. Thank you.